Hi, and welcome to the two-year report of the Dallas-Fort Worth Business Group on Health, IQ Health Initiative on low back pain. I'm Scott Connor, the medical director for the business group, and I'm really excited to share with you the results of our work. Now, we know this is a big problem. In fact, Michael Thompson of the Alliance recently came out with a quote that says, "While waste has long been identified as a key concern and cost contributor, employers are operating blind and need to look for more disciplined approaches to address the top drivers that influence waste." And that's what you all did with the Business Group on Health, IQ Health Initiative. Now, we know that low back pain has got very high variability in terms of the care. So the Dallas-Fort Worth area employers, as purchasers of health care, launched the IQ Health Initiative to collaborate directly with providers, the suppliers of healthcare services, to create improved processes focused on providing patients, your employees and their dependents, high quality, safe, and efficient health care around low back pain. The IQ Healthcare Project team worked with each of 4 participating groups, 2 in primary care and 2 in specialty care, to review and document their current process of care, then to study the research and the pathways that have been published to find out what worked best for their practice and implement that and for all of the patients or your members and their families. What they came up with consistently as the evidence-based standard in care is that as quickly as possible, within 24 hours preferentially, a patient at this point, would be evaluated. You'd look for the very dangerous things that can occur that would cause low back pain, and if they're ruled out, then that person would be put into non-invasive physical therapy as quickly as possible. Now, 3 of the 4 groups actually did investigation into and worked with a company that we are familiar with in North Texas called Rosti, and they do what they call myofascial release, active and passive, and there are also a number of physical therapy units that they work with, and they do a different form of therapy, but the point was conservative therapy was the first step. Now, 80 to 85% of the time, that actually takes care of the problem. And imaging at that point, x-rays, CT scans, MRI scans, whatever's appropriate for the patient is necessary. Based on what they find, the next step is often that they would see a specialist. They would then get a series of steroid injections if it was a disc, say, in the upper back or lower back, which we were looking at. And if those did not work, then a surgical intervention may be appropriate. So this standardized pathway of care was evidence-based and found to be very important. We then were fortunate that 3 of the 4 insurance companies in North Texas were willing to give us their data, and thank you very much for all 3 of you for doing that. We took the data, put it in a repository, and we asked the question, what percentage of the time in North Texas do people actually receive this evidence-based care? And what we found is that 29% of the time in North Texas, that's what occurs. With our 4 groups, we found that it was somewhat better than that, and the exciting thing was after they went through, reviewed their practices, reviewed the literature, we've seen an increase in the percentage of people that go through this pathway since the program began, which, because of the lag in claims, we just really have gotten going with their changes. So it's very exciting to see that this process of working with providers is making a difference. Now, you may not realize it, but if we could get 49%, not even getting to half the people in North Texas getting appropriate therapy, we would save you, or you would save, excuse me, over $10 million a year in the treatment just of low back pain. And that's going up 20%, from 29% to 49%. Imagine what it would be if we could actually get to 79% or something even higher. So when we look at the cost of the participating groups following the pathway of care, it's $569 per member to go through the pathway. Non-participating groups were $606. Now, if they went through a different pathway, or one of the things we see frequently is they come in, they get seen, and boom, 85% of the time, they get a x-ray, and that could very well be inappropriate and very expensive. So we see that with that the average cost was $1,978 for those that didn't follow an appropriate pathway of care. So the savings to you on average is $1,440. So that's really important to show that decreasing variability, increasing quality, making sure that people get the right care would save you tremendous money. So what can you do about it? Well, there are three things we'd like to ask the employers to do immediately. First of all, go on to the Dallas-Fort Worth Business Group on Health website and download the Employer Toolkit, which has a number of ideas of how you can implement things today and over the next year in your plan benefit design, as well as your environment and your selection of providers to get people into the right care. In addition, there's a savings calculator that would actually show you if you got more people into the right care, your costs would go down dramatically and how much it would go down. So go to the IQ Healthcare tab on the website. Secondly, don't be shy about working with providers. It was a great experience to have the providers and the employers in a room together, and I can tell you without exception that there was a significant improvement in both the confidence of the employers, and they seemed to really enjoy what they got from being with the providers. So I'd ask you to talk to them as you socialize today, and don't be shy about that. And thirdly, use benefit design to get more appropriate evidence-based care, and let's drive value-based healthcare in North Texas. For the providers, thank you so much for your hard work. For those of you who didn't participate, review the way that you have people follow pathways. Operationalize evidence-based care in your practice, and the Dallas-Fort Worth Business Group on Health will try to shine a light on the improved care that you're giving people and help you have more and more patients sent to you. And finally, I'd like to thank the health plans that participated with us, because you made a huge difference in helping us make this an evidence-based initiative. And without you, we would not have been able to appreciate both the variability and the improvement and costs that we see. When you go meet with the corporations, both inside and outside of the Dallas-Fort Worth Business Group on Health, please do share and encourage them to adopt evidence-based pathways in their plan benefit design. So thank you very much, and I look forward to future endeavors with the Dallas-Fort Worth Business Group to improve the value and quality of care in North Texas.